Dr. Sharma, who is our next speaker, is going to continue to do that. And I can remember Dr. Sharma from 4 or 5 years ago, and I think the blurb that we put on his little focus on who he is that he was contemplating oral surgery school or investing in marketing. So luckily, wherever he went, he chose the right one. He opted out of oral surgery school, and no offense to any oral surgeons in the room, but we got him to look at his practice as he was missing a lot of opportunities. And this is in a good market in Phoenix suburbs. So he's getting mic'd up. He'll be up here in a minute. But I think we've enjoyed probably 5 years with Dr. Sharma. It's been a good 5 years, and he's got great doctors now working with him, working for him. What? How engaged, Leslie. So Leslie wants me to talk about how engaged he was. And really that's internal vernacular for he called us with concerns, questions, sought suggestions, recommendations, sought out people that could help him. It wasn't just a marketing campaign, which some of our clients use us for marketing. That's singularly what they look at us as. And while we love that, we do want to be more immersed and more involved in their practices. And we love guys like this that they just want to learn. They want to learn from the best. They have questions. They want them answered. So, Dr. Sharma, I'm going to give it to you from here, man.
Oh, boy.
Enjoy. Like I said before, don't let me down.
Thanks, Corey. Thank you. We first came to No Limits, my team and I. There were 5 of us total, about 4 years ago. And we had started using Chrisad maybe 6 months before that, maybe 4 months before that. I think we had our first 80,000 a month, and we walked around here like we were the shit. So my name is Manoj Sharma, and I used to hate work. It sucked. It was boring. The office wasn't making any money. I was planning on leaving, selling the office, and going back to specialize. Actually, Corey, it was perio for whatever reason, because specialty is where the money's at, right? Because I don't know any impoverished specialists, or at least not back then. And I got accepted to a program, and I thought, okay, back to specialty, back to school. Ironically, a couple years ago, I met a 38-year-old periodontist who graduated later, bought a couple of practices. He went down fast. The nicest guy in the world. Specialty is not the answer. The answer is how do you run a business? And I had no idea, and I'm still learning. I think one of the interesting things about my presentation is some of these guys who presented to you, the Justin Kochs and whatnot, these guys are big guns. These guys are giants. And what I did is just walk in their footsteps, right? So I'm not that smart. I'm not as smart as Justin. I'm certainly not as well-dressed as Declan. So let's see what I got. So I was an English student when I went to dental school, and I wrote this BS letter to get into dental school that said something about the merger of art and science and how communication is what's going to separate me from the others because I'm a really good communicator. It's amazing that I was right back then, even though it was total crap. I really just made it up. Because the next 10 years, I didn't spend any time focusing on how to communicate with people, how to talk to people, how to make money in dentistry. Zero. Just got better at being a dentist. We had a dinner meeting last night, and there's a dentist in here, probably the smartest dentist in here. Her name is Puneet. She's young, and she's starting a practice in a few months, and she's here. That's how I know she's the smartest dentist in the room, because it took me 8 years of floundering to get here, and she's here already. So she's smarter than me too. A few years ago, I felt the economy turning. I thought I would try Chrisad. I actually used to be a Chrisad associate. My old boss used to come to these meetings. And it's funny because he didn't implement the way that Leslie taught me to. He would pick and choose certain things. He would say, I'm going to do this idea that a genius told me to do, and I'm going to tweak it a little. I'm going to do it because I'm a general dentist, so I must know how to make money in dentistry. So I'm going to tweak this idea a little, and he never really grew. He also didn't have a whole lot of personality. The first meeting with Josh, there's a few Joshes in here. We're talking about bearded Josh. My first meeting with Josh, he came to the office and he asked me, he said, what do you need to get this practice going? And I said, I just need new patients. I said, I'm amazing. I just need new patients, and I will do just fine. Josh asked me, he said, what are you going to do with those patients? And I had no answer to that. I really had nothing. My best answer at that time would be, I'm going to drill on their teeth. Is that what people want? I bet there's no one in this room who wants me to drill on their teeth. But I'm pretty sure that that's how I thought I was going to grow a business. That's going to send me into retirement. That's going to make me a rich man. It's not. It's not. And the smarter people already know that. So my practice back then, we were averaging about $50,000 a month, which is $0 in my pocket. I was 1 foot out the door. And so I called Corey, and I said, what are we going to do? And we implemented a strategy, because we had no strategy. We didn't know how to make money in dentistry. We had no strategy on how to talk to people, how to answer the phone, what is a green light, and all that stuff. So where's my little clicker here? My practice was stagnant, and growth did not necessarily mean new patients, right? Because again, Josh is going to get me plenty of new patients, he promised, and I was going to drill on their teeth, right? Well, what is the green light theory? You know, a few weeks ago, I went to a really fancy seafood restaurant in Phoenix, a new place called Ocean 44, and from top to bottom, from the beginning of the experience to the end of the experience was fantastic. The valet guys, the ladies who walked me right to my table, the table was amazing. The sea bass was amazing. You know, when they called, the post-op call was amazing. When they called me afterwards, I made my next reservation. So they're selling seafood and steak, but they're selling an experience. It's the experience I bought into. And that's what we're doing too. Don't think for a second that you're not selling an experience when patients come into your office. You're selling yourself, you're selling an experience to them, and that's how they're going to open their wallets and spend some money, right? Because people don't buy stuff from people they don't like or when they have a bad experience. You know, another great experience I had recently, I knew Declan would be wearing red shoes, so I needed new pants for my lecture. And I went to Nordstrom, and this guy presented, you know, he's like, well, you're lecturing, you need new pants, you need a new jacket, you need new shoes, and a couple grand later, here we are. And I did it because it was the experience. That guy made me feel good about buying stuff. He presented in a way to me that made sense. I have no regrets about buying 2 jackets when I didn't need one. Somebody recently said we make financial decisions sometimes, you know, irresponsibly, impulsively, but we don't necessarily make bad decisions. And I don't think it was a bad decision. I think I look pretty good. So we started looking at patients as consumers, right? Patients are coming into your office with money, and they want to spend it, and you have no idea how to get it from them. I used to think the big case model was the way. That's not the way. You know, patients come in, my new rep, Josh, said that they all come to you with a $1,500 gift card. And too many times we say, all right, well, that's fine, but you're going to have to pay extra first before you can come to see me. And that doesn't paint us as a very good guy, right? So now we ask our consumers what it is they want. They want convenience. So we changed our hours immediately. We started opening late. We started opening early. We opened on Saturdays after a lot of complaining. But we did it. The reason we did it is because within a few months, everything Josh said was going to happen came true. We had more new patients. I was drilling on more teeth. But we started talking to them a certain way. And I'm going to repeat it a few times today, but I only have one goal when it comes to dealing with a new patient in my office or any patient in my office, is I want that patient to come back to my office. That's it. So let's start, and I repeat this at every meeting, let's make sure that we focus on getting the patient back. If they want to come back for another free cleaning, awesome. Free is my second favorite F word, so come back, free cleaning. The free cleaning thing is brilliant. It connects people to your office. When you're making $500,000 a year, writing off $25,000 is a huge amount. When you're making $3 million, it's not. And what you really want is a hook. And what that does is it brings them back. And why is that important? Because everybody breaks a tooth, don't they? Right? So if you want to do the crowns, you want to do the work, you got to endear yourself to them first. Right, guys? We now track our growth. We follow the math. We ask our patients, our consumers, what it is that they want. It was shocking to me that the number of patients who did not remember my name. That hurts. That hurts. I spent a lot of years coddling these people. And they all still come, and that's great, because I really worked hard to be nice to these people. But it's amazing how few actually remembered my name. So Josh, when he first came to the office, he met my office manager at the time, you know, an older lady who couldn't manage her own life. And, and here's Josh, and I'm listening in on the meeting, and here's Josh telling her, he says, he's telling her, this is what we're going to try, and I said, we're going to be open to it, and Stephanie's in there saying, that's not going to work. That's not going to work. That's definitely not going to work. And our office did 500. Josh works with offices that do 12 million, 20 million, and she's telling him what's not going to work. I realized this is my Costanza moment. I heard Seinfeld has been mentioned a few times. That warms my heart. That's one of my favorite shows. And if anybody remembers, George's instincts were wrong on everything, so then the opposite would have to be correct, right? So I fired Stephanie, and I just started doing the opposite of every instinct that I ever had. Started making some money. There are two ways to practice dentistry. I'm sure there's many other ways, but I say this all the time. You can practice dentistry, or you can make money practicing dentistry. And the second one is a lot more fun, and I've done both. So I can tell you from experience that that's the case. So what is marketing? You know, there's a number of different kinds of marketing. Primary marketing really is getting patients in the door, right? Just like Josh said, I can get you new patients. We're going to send out mailers. Patients are going to come in. Awesome. What is secondary marketing? How are we going to charm these people? Dental patients are afraid. They don't want to be there. There's needles, there's blood, there's stories. They think you're going to rip them off. What's the first thing you're going to do? Damn, look at these teeth. No. We're going to try to be charming. I never lead with, what's your current dental situation, as much as, how are you, where are you from, what's your name, all that kind of stuff, right? It's amazing how many associates I've had to say, when you walk into a room with a new patient, a stranger, put your hand out. Look them in the eye. Shake their hand. Introduce yourself. Has anybody introduced themselves to Justin Koch this weekend? Because that guy will look you in the eye the entire conversation. And we have established that Justin's a genius. Pay attention to that, because he does all the little mathematical things precisely and correctly, and that's one of them, right? I'm not a math guy. Sometimes I deal more emotionally and with people, but when you look somebody in the eye, and you treat them a certain way, and you talk to them a certain way, and your only goal is to get them to come back to your business, they're going to spend more money. They're going to buy more stuff. I started reading some books. I hope everybody noticed that all the geniuses in the room talked about reading, whether it's Audible books or whatever. Everybody talked about reading. And I started reading a book by Carnegie because I wanted to win friends and influence people. And somebody I know who's much smarter than I am told me to read it. And one of the interesting things from Carnegie is he talks about how the most beautiful language that a person ever hears is the correct pronunciation of their name. Know your patients' names. It's really simple. Know how to pronounce them correctly. You know why this bugs me? Because everybody mispronounces my name. So I go to a medical doctor's office, and I'm sitting in the waiting room probably an hour. Somebody opens the door. Four-man Joe. For Manoj, for, is it you? It's embarrassing. It's embarrassing every time. I hate it. I walk up with my head down. And then I go in the back. They make me take my clothes off because my knee is hurting. Why? The only reason I'm going back is because I have to go. I like the doctor. He's Canadian. He's a nice guy. I'm Canadian, so I like the guy. We get along. He's not really after my money. He's probably going to help my knee, even though I'm sitting there naked. And of course, he says, hey, man, Joe, how you doing? Long time no see. He doesn't have to pronounce my name correctly either, but you do. You do. The number of times I go out into the waiting room if I'm running 5 minutes behind, because I hate running behind. I never run behind. I'll go out in the waiting room, and I'll shake somebody's hand and say, hey, John, I am running 5 minutes behind. Give me a few minutes, and I'll get you right back. It's little things like that that create a brand, that creates a methodology, that creates a vibe, right? And that's what people say when they come into my office a lot is, it feels good in here. And that's all about my staff, and I'll talk about them in a minute. My only goal is to get the patient back into my office. Let's talk about dental marketing for a second. Nobody ever talks about dentistry at these meetings, and that's probably good. We're not really here to talk about teeth. But I've had associates all year last year, and I've got a great one now, but I broke a few eggs last year, and it's amazing how many temps fall off, how many temps aren't polished, How many times they'll sit down, prep a tooth, get up so the assistant can make a temporary and go sit in my office and check their phone. Do better dental work. That helps. If you don't know how to do better dental work, go to Spear. He's going to teach you. But don't forget about this meeting, too. That's my point. You have to be a good dentist. Everybody established that, and that's going to make it a lot easier. Associates sometimes struggle with that. Some of them don't. I can guarantee you Dr. Phil doesn't, but some of them don't. But most of them will struggle a little bit, especially if you believe that 1 to 3 years out of dental school is the ideal associate. I don't, but that's one argument I'll have with John. And then I wanted a quick thing about dental implants. Somebody also mentioned something about implants. There's no silver bullet, there's no one thing that you should do. And I agree that you probably shouldn't focus on dental implants. But I do surgeries, and I like doing implants surgically because I learned a few years ago that implants should be designed from the restoration backwards. And it's just a quick thing about implants, because the more you do that, it's a service your patients want. And that's really nice in dentistry, because sometimes they don't want to come see you. But often they want to replace that tooth. If it's a front tooth, they'll be there tomorrow, right? So if it's a front tooth, they come tomorrow and you say, awesome, we're going to do an implant. It's the latest and greatest. Go see a buddy of mine. I have no idea what he's going to charge you. Let's hope he puts it in the right place. Come back when it's done, and I'll take care of it. I'll make it look nice. Now, of course, if you send him to an oral surgeon, they put it in the wrong place. It comes back, and now you're stuck doing a crown on an attractive young lady that's not going to turn out right, and you're on the hook. This is why specialty isn't the answer. So you need to take control of some of that. But implants are a huge part of the practice, and definitely a part that took us to the next level. My staff. We all like to, most of us like to shit on millennials, right? They're lazy, they're young, they don't work hard. It's bullshit. I was the first one to say that I didn't like millennials, and then I met Nicole. Nicole started in my office when she was 17 as a hygiene assistant. When she was 18, that was when I fired Stephanie, and I went to Nicole, and we had been cross-training a little bit, and I said, okay. I said, Chrisad is telling me I need a fresh face, a smile, somebody with a lot of personality, somebody who people like. I said, you're the only likable one in the office, so it's going to be you. So I said, can you do it? She's 18, doesn't know anything about insurance, nothing. You know who else doesn't know anything about insurance? I said, can you do it? I said, we've got Josh and Leslie, and we've got a team that's here to help us. Stephanie didn't know anything, so it can't be worse. Can you do it? She said, yes. She's 25 now, and she's right there. And, the other day, we had a patient come in for a wisdom tooth referral. It's going to be a 30-second exam. I'm going to be in and out. You're going to the oral surgeon. You're 19, impacted wisdom teeth. The mom is sitting in the room, and the moms are my wheelhouse, so I get along with moms. So mom's giving me the smile, and I said, yeah, we're going to refer her out for wisdom teeth. And she said, well, we're here also, we've got a family, and we're trying to find a new place. We're not, we wanted to check and see if you took our insurance, and bang, Nicole said, your insurance works great here. She said it casually. She said it in a way that it had meaning. It's a scripted line. People talk about scripts, and that is a script. But the way she said it, all 5 of those people went up front, scheduled. My number for an exam is about 1,000, maybe 1,100. So how much money did Nicole put in the office with those few words? $5 or $6 grand. I put Nicole in a suite at the Cosmo. Bonus. So after a few years, we doubled in size. We did it. It was pretty easy, actually. Josh said, your schedule, you're going to realize after you do, 100, 200 a month, you're going to realize that there's so much room for so much more, and there is. There really is. I'm going to talk about efficiency in a minute because I'm a huge fan of same-day treatment. I'll do same-day treatment all day long. It's because I'm lightning fast, so I like it. I love when my number for the day goes from 10 to 15 to 20. That's a great day. But to get to that next level, to get to a place where we were going to have multiple doctors, because first your job is, Puneeth, if you're listening, first your job is managing assistants, right? And then your job is going to be managing hygienists. I'm sorry, I had a reaction there. It happens sometimes. Now my job is managing doctors, and it's a bit more challenging. This is an interesting challenge. And why is this an interesting challenge? Because there's ego involved. Hygienists have ego as well. You just can't beat it. You can't win with it. But talking to doctors on a certain level, it requires a little bit of something, right? So I needed help. There's a gentleman in the audience right now, James McCready, consultant Jim McCready. If you haven't talked to him this weekend and you're thinking about adding associates or growing your business, talk to him. Jim took our practice at around $1 million and created a structure, created a company. I'm not a dentist now, I'm a CEO. Paul, Nicole, and Carrie, who've been with me for years and years, are now my managers. They manage my office. I deal with them. Sorry about that to the auxiliary guys, but I deal with them only because it makes my life a little less stressful, right? So we set up a corporation, a company, and I'll tell you what, that has made my life dramatically easier for a number of reasons, and I'm all about lowering my stress. I'm getting older now, so lowering my stress is nice. Jim taught us about business, about setting goals, about having core values, about having fundamental beliefs in your company and what it is you do. And it's really interesting, that first meeting where we talk about all that stuff and where we set up our corporation and our beliefs and our values. You know, one of our core values that I want to make sure everyone on my staff is funny. That's the one I picked, because I'm funny. So I want you to be funny. You know why? That provides for a consistent experience for our patients. McDonald's burgers have 2 pickles on them every time. Not because it's a good burger, because if you think that's tasty, you're going to get it again and again and again. The consistent experience. And that's what we're trying to do. Jim got us set up with treatment coordinators. I've heard some people talking a little bit about treatment coordinators, and we started doing this a couple of years ago. I would never work without a treatment coordinator. This is a liaison between you and the patient's money. Sometimes what we used to do in the past is I'd tell the patient, okay, this is what you need. I do things the way Justin taught me. We're going to do an exam. We're going to sit up. Come on over here. We'll talk about what's going on. Here's your x-rays. Here's your treatment. Here's some intraoral photos. See you later. Do you have any questions for me? That's always the last thing I say. Any questions? And they say no. And I say, okay, cool. See you later. Then somebody actually takes the patient, walks them up to the front, sits down, treatment planning. There's too much time has elapsed between what I told them. They've already forgotten what I told them from the chair to the front desk. So now one of the front desk staff comes into the back. They coordinate that treatment. So as soon as I get a question that has anything to do with money, Nicole or Iris are standing behind me. They are our insurance person. They're our insurance expert. They're going to sort all this out for you. They're going to tell you where to go, what to do. And then I get up and leave the room. And that's how that patient gets on my schedule. And that patient knows exactly how much it's going to cost. There's no stupid Dentrix breakdown, 3-surface bullshit MOD composite. They don't know what that means. Stop confusing them. Where's Bobby? Treatment 24/7. If you're not using it, use it. That's it about that. Jim taught us about power. And Justin talked about trust transfer. And I think that's brilliant, because what Jim calls it is power passing. And nobody in my office is left alone. Nobody's sitting in a chair kind of looking up, playing with their phone. We want to make sure that somebody on my staff has the power over that patient at that time. If it's me, it's me when I'm in the room. When I leave the room, I make sure that if somebody else is going to take the power, like a hygienist or a treatment coordinator, I introduce that person. This is Nicole. She's the expert. Do you know what that patient thinks? That's Nicole. She's the expert. And so they listen to her. That's power passing. That's transferring the trust, right? You have to do that. Because if I'm good enough, I'm the leader of the team. I have to be able to go in and create trust, and I'm getting better at that. But then I have to pass it off, because somebody else has to take that person's money, or schedule that person, or talk to them about credit. I don't want to talk to them about credit. That's not very fun. When you pay attention to what it is your consumer wants, when you do the research and you find out that a type A personality only is going to get annoyed after about 4 minutes waiting in your waiting room, you don't make that person wait anymore. So read that Chrisad research. That's what opened up my eyes to what it is that people want and how it is we're going to give it to them. Primetime hours, convenience, my office is spotless. I'm always picking stuff up off the floor. I love that. Whoever said that about picking something up off the floor, that was great. Et cetera, et cetera. That's how you grow a business. So a couple years ago, John himself came to my office. You think I'm nervous now? Whew. You should have seen me then. It's like JC himself is coming to the office, right? Jesus is coming. You better be looking good. Put on a tie that day. So John looks around. He's got his Gucci jacket on. And he looks around the office. This is a nice office. He says, what do you want to do in this office? He said, I want to drill on teeth. No, I didn't say that. I said, I don't know. I said, I'm doing good now, finally, thank you, and all that bullshit. And he says, well, what kind of numbers do you want to do in this office? 2 million, 3 million, 5 million, 10 million? I'm like, dude, we just cracked 1 million. Stop pressuring me. And I said, okay. I said, well, 2 million would be nice. He said, well, you got to add more hygiene. I said, okay, I'm going to try. You're not going to try, you're just going to do it. I said, okay, well, so how about getting to 5 million? He said, you need to add more doctors. And I said, I'm going to try. He said, don't try, just do it. Yoda is in my office. There is no try, just do it. That's right. And I listened. Thank you. Number 3, after adding more hygiene and adding more doctors, is one word: grow. And that's all that's been happening. And it's wonderful. John said that day, he said my favorite quote, because I told him, I said, John, I'm not convinced that my area can sustain a $10 million practice. I said, I've been here a long time. I'm a nice guy. I don't think we can do that. And John said something that I now repeat almost every day when I get up in the morning is don't dictate to the market. Let the market dictate to you. Don't tell the market what to do. Do what the market wants you to do. Open on Saturdays. Open on Sundays. We did one Sunday last year. $8,000 without batting an eyelash. Open early, open late. Yeah, it was my associate, I know. Don't dictate to the market, ever, ever. You're just making a mistake. The key, I think, to some of the ways that I like to practice is communication. And I said that first, that I was an English student, if you can't tell. And I like to talk. I think I fancy myself a good communicator. But I've noticed that a lot of people aren't necessarily that good at it, and that's what's getting in the way of their growth. And sometimes it's doctors, and sometimes it's hygienists, and sometimes it's assistants. But a funny story. Michelle was a hygienist who worked for me, and I could hear. I hear everything in my office. I designed it that way, and I could hear her telling patients that if they flossed with those floss picks, that those floss picks were for small children and the handicapped. And she just, every time about no flossing, you need to floss, and you got to make it look like a C, and you got to do this. And the stats I've heard on people flossing is more like 95%, but I'll go with 90. So what exactly are we trying to achieve by berating patients about flossing? Nothing. You're not achieving anything. You're doing that. You're kicking them out of your office, right? And that's not good. That's not how you're going to grow a business, right? You're selling a product. You're selling yourself. Connect with them about something else. I play a few instruments. I love talking to patients about music. We play cool music in the office all day long, and I love talking to them about it because it connects them to me. We talk about sports. Me and Paul are always talking about sports with people. The Patriots. Brady sucks. Kraft is horny. The New England Patriots. So I want to talk about a few specific stories in the office with specific patients that'll illustrate some of the communication challenges that some people have and how patients respond better when we communicate a different way. Troy was a patient who came to me about 10 years ago, and Troy's about 400 pounds, and we're about to lecture him on periodontal disease and health. Troy doesn't care about his health. He made that real clear when he walked in. And Troy was a no copay or bust. He said, I need a cleaning. I've got tartar up to my nose. I said, I really need a cleaning, but I don't want to pay for it. My insurance, he knew his insurance. My insurance is going to pay you $300, $400 for a SRP, a deep cleaning. That's all I want, and I know exactly what it's worth, but I don't want to pay any money for that. So naturally, what did I do? Sent him on his way. And I'm sorry, I can't do that. I got to collect that extra $400 for the copay. Otherwise, you can't have a cleaning. Some doctor, right? 8 years went by. And Troy's wife, Wendy, still comes to me. And we started working with Chrisad. I said, Wendy, I said, hey, I know, and I said, the story stuck with me all these years. I didn't look it up or anything. And I said, Wendy, I know Troy needs a cleaning. You know, we don't charge for cleanings anymore. Why don't you get him to come back, and let's do his cleaning for nothing. She said, really, you deep cleaning for nothing? Yeah, go tell him. He was right all along. Big Troy knew more about business than I did. He doesn't floss still. So I introduced, I power passed, I trust transferred to my hygienist, Desiree. And Desiree sat down with Troy and spent a few minutes with him explaining what she was going to do. She didn't hurt him. She was real nice to him. Troy comes back every 3 months like clockwork. Do you think he asks for me? He asks for Desiree. Maybe after 4 or 5 cleanings, after coming three months, and I go in and do my hygiene exam. Yeah, you know, we've got these fillings you need, you know. Maybe we can get that done, and of course it's Troy. He's not going to get that done. I'm sitting in my office, and I hear Desiree say, hey, maybe we should fill these cavities on the 4th or 5th time he kind of comes in. And of course, what do you think Troy said? I have cavities? They're not listening to you necessarily. You maybe need to reevaluate how you're speaking to people so that they listen to you. And he did have cavities, and we did fill him, and he paid. See, he didn't want to pay for cleanings because he didn't feel like he should. But he paid for those fillings. It's interesting. People's perception about what a filling is and its necessity versus what a cleaning is and its necessity. 8 years went by, and Troy did not have a cleaning. We sent him on his way because we wanted to collect the copay. We didn't treat him. He didn't get healthier. He didn't die, but he didn't get healthier. He got treated when we used the Chrisad method. He got healthier when we used the Chrisad method. Make sense? Be a doctor. This actually gives you the opportunity to be one. Kind of nice. I like it. I always wanted to be one. Jim Collins is a funny old guy. He comes in, and everybody knows this patient. Most of his teeth are okay. Number 8 is hanging about 4 millimeters south. It even might be dangling a little bit. There might be some mobility. You got to handle this guy a little delicately. He's a grumpy old man. And so I said, one day, you know, and I love a challenge. My challenge is, you know, Carnegie talks about sometimes he will just go out in public and just try to make somebody smile who looks like they're having a bad day. You should all try that. You know, if you're not the kind of personality, if you're not as cool as maybe you think you are, go out, talk to some strangers, and see if you can make friends with people. Because if you can't, that's what you need to work on, right? Be friends with random strangers. We were at a bar yesterday. Go pick somebody up. See if you still got it. Because if you do, you're going to win friends, you're going to influence people, you're going to sell more stuff, you're going to make more money. It's not about drilling. I can teach you how to drill, Jim. Take me 5 minutes. So it's not about that. So I asked Jim, I said, Jim, what is going on? I said, are you happy with your smile? He says, yeah, it's fine. I don't want any work. I said, okay. Okay, what is my response to that? See you at your next cleaning. I mean, if you don't want any work, I'm not going to force you to do some work. That tooth needs to come out. I'm not going to force you into an extraction. Someday it's going to come and tell you, hey, I need to come out, go to see Sharma. But it hasn't come out yet, so he doesn't want any treatment. So I said, okay, cool, 6 months, see you later. He comes in 6 months again. And this number 8 is hanging. It's driving me nuts. And I noticed Jim was listening to the music real intently. And he's tapping his fingers on the thing. I said, Jim, you like this jam? This is your jam? He said, well, I was at Woodstock. Some of the young people don't know what Woodstock is. I said, really? Because now I know I've got him. Because any musician, anybody who loves music, I got him. And I said, really, Jim? I said, you were at Woodstock. And every time Jim comes back, he tells me some crazy-ass story about what happened at Woodstock. Including one time where he took the car that they took to Woodstock. He's like, we left that thing there. We lost that car. He's like, it's still probably there, right? Visit number 3. Jim, are we fixing this front tooth? Well, I don't want to fix it because the last dentist said, not anybody at my office, but the last dentist said he was going to rip that thing out. He was going to grind the shit out of my teeth next to that space. He was going to stick something on there. I don't know. I might have had to take it out. Maybe I left it. I don't know. I said, Jim, that's a terrible idea. You know what we should do? We should gently wiggle that tooth out of there. I'm really good at extraction, so you're not going to feel anything. We should do a little preparation on the adjacent teeth. We'll put a fixed bridge in there. My hand goes out. Paul puts a bridge in my hand, a beautiful zirconia bridge. Look at it. It's beautiful. Jim said, that's a good idea. I like that. I didn't say anything different. I just said it differently. Does that make sense? The key is trust. Everybody said it this morning. And I got trust from Jim because Jim's been to Woodstock. You want to do more drilling? Build some trust, win friends, and be influential. Everybody who's planning on opening a business who hasn't read that Carnegie book should go read it. They should go read it today. It won't take you a couple days. Carnegie said, don't ever condemn, criticize, or complain. Carnegie has never met an associate dentist. The final story is my favorite because it involves an associate who used to work at my office. And do I have that, Nicole? There we go. No, it's not. Thanks. There it is. Okay, thanks. Associate, we're going to call her Dr. Treatment Plan. Any guesses what this patient came in for? I swear to God, this guy is 22. He probably has minimal income. He came into my office because number 10 had a big hole in it. And he said, I'm graduating in 2 months. Can you fix it? This is what she came up with. Does anybody think that this 22-year-old without a whole lot of income cares about his cheek-biting habit? He's chewing his cheeks. He grinds in his sleep. Importance of better home care? This guy left the office and never came back. He said, I have no idea what she was talking about. She certainly doesn't want to fix my tooth. It's the only thing I can afford. What are we going to do? Doctor Treatment Plan. Do you know what this doctor used to come and ask me? Consistently, how are you going to make me busier? In fact, every associate has asked me that except my current one. The other day in a meeting, Dr. Jim, my new associate, stood up and said, it behooves me to do things in a similar style that Dr. Sharma does them because it'll make for an easier transition for your patients and they'll feel a little bit more comfortable with me there. My staff stood up and applauded. I just realized they've never stood up and applauded for me. Today, right? Some people just get it, and some people don't. And unfortunately, I've had mediocre experiences with young assistants, so I don't like the idea of 1 to 3 years out of school. They don't know how to talk to people yet. And if they kind of do, they haven't focused enough on the dentistry. They haven't seen endo posts come back with the crown and the post in their hand. They still think they're great at endo. So my opinion on young dentists, I'm sure there's some great ones out there. None of them work at my office. But Dr. Jim is awesome. They've all asked me how they can be busier. Nothing drives me nuts more than that. And I like to tell them, look, if you're not problem solving, if you're not solving a problem, you're just complaining. Complaining doesn't get anywhere. Carnegie just told us not to do that. So if you're not a problem solver, you're just a complainer. I've tried this in relationships. This is why I'm still single. But at work, it works really well. This works really well. Pick one thing. So what did Carrie do? Carrie's been with me the longest, 8 years, right, Carrie? Carrie says, hey, this kid came in. I came in the afternoon. She said, this kid came in. He just wanted his tooth fixed. He's graduating. Dr. whatever said, I don't know what she said. Can you fix it? Sure, get him in this afternoon. 2 hours later, the kid walks out of my office, endo, crown, beautiful temp, because I make my own temps. And then he graduated a few months later, happy. Someday he's going to break another tooth. Where do you think he's going? Where do you think he's going? That's right. Jim will see him. I tell my staff all the time to bring me a problem as well as a solution. That's the management team. And that was a No Limits in 2014. That good-looking kid on the right manages my back office right now. He's one of the smartest, most motivated 20-somethings I've ever met. Take a minute to talk to him if you get a chance this weekend. He's single too. Associates, this is a tough one. I'm learning, as I just said. I've got Jim McCready, and we train, we work with them, we do our best. It's a challenge. I think we're up for the challenge because my back hurts sometimes, and it's really nice to get out of the chair. And we've doubled twice in the past 4 years using the Chrisad philosophy. We are a Chrisad office, a proud Chrisad office. My associate, I'm glad to bring an associate here. I was glad to hear from Dr. Phil. That guy is awesome. And I tell people this, be positive. Share the core values. That's how you're going to find a good associate, right? Get someone who's a little bit like you. Am I doing on time? And if they're a little bit like you, they'll treat your patients the way you treat them, and your patients will like them too, and they do. And it's funny, one of the things my mom always told me when I was younger was be humble. She always said that. I always thought it was a bunch of crap. But one of the things that, without question, the number one thing that allows, that patients in my area like is that I'm kind of a laid-back guy in the office. I'm as dressed up today as I probably ever will. A friend of mine would think someone died. You've got to develop your managing skill. You've got to get out of your own way. Check your ego. And make sure that you remember that our job is about our patients, our consumers. It's about them, not us. If you always remember that, if you always remember that our job is about our patients, you're going to make more money. You'll be happier, I promise. This is the worst set of dentures I've ever seen. And this guy, this is my last story. So this guy went to a corporate office because he needed a tooth taken out. And they sedated him, and he woke up without any teeth. And a couple years later, we heard about it on the news. And of course, my young, energetic millennial staff said, hey, why don't we reach out to this guy? You like doing, look at that overjet. If anybody thinks that's good, come talk to me, please. Look at that. So he goes to a corporate office, they take out all his teeth, he makes the news, and Nicole, Paul, Carrie, and myself decide to reach out to this guy. And we did. And we made him permanent teeth. And the reason why is because, I want to finish this story because it's great. The eyes are wide open there, Dwayne. When he came to my office, first we wanted to know, is this guy a good guy? Are we just going to do something nice for some asshole, or is he a good guy? So he came to me and he sat down and he said, Doc, I said, Dwayne, what happened? And he told me what happened. I said, what do you want? What are your goals? I want to eat fruit. It's been 2 years. Salute to corporate dental. That's what they do. Have you noticed it's always Aspen Dental, Bright now, or dental? It's never dental care. They've sucked the caring right out of it. And the thing about the Chrisad model that I like the most is that it's the anti-corporate model. It's the salute to corporate, right, John?
Increased utilization.
Yes.
Yeah.
So we want to put the care back into dentistry, right? And so we did. So we did some free work for this guy. We made him permanent teeth. He looks great. And the other day, this was last week, just before Chrisad, and the reason I grabbed my phone and I took this picture was because he told me that just before he left work, he was in the lunchroom, and his coworkers asked him, "What are you doing in here? You don't eat." Now he eats. I don't want to throw, the name of the corporate office. I don't like throwing people under the bus, Western Dental.
By the way, Western Dental used to be called Cigna Dental in Arizona until 1986.
Well, the best moment in the office last year was the day we finished with Dwayne. We didn't take any money. This is part of our values. This is life. And this man can eat fruit now. And what did it make me feel like? A doctor. You know what this is? This is freedom. And you know why this is freedom? Chrisad. Thank you, John. Thank you, Justin. Thank you to my incredible team. Thank you.
Thank you, man. Thank you, Manoj.